Turmeric can be such a powerful herb and supplement for arthritis. It happens to be also one of my favorite supplements to fight arthritis as well. If you want to learn the different ways that turmeric can help fight inflammation and pain, then keep watching. Hi, my name is Dr. Micah Yu, board certified integrative rheumatologist, and today we're going to be talking about how powerful turmeric can be for pain and arthritis. Turmeric happens to be one of my favorite spices, and it's also one of the first supplements I took when I was battling my own arthritis as well. So there are a lot of ingredients in turmeric because turmeric is the actual vegetable and spice. Curcumin just so happens to be one of the most important active ingredients in turmeric. And turmeric is also known as curcuma longa. I love this spice because it has so many use cases. It's anti-inflammatory, it's an antioxidant, it's anti-cancer, it's also antimicrobial as well. Well, why is turmeric one of the best supplements and spices for arthritis? Well, we know that it can decrease inflammation. However, did you know that it can also act on the gut microbiome as well? So when we have autoimmune disease and inflammation in the body, we can have an imbalance of the gut microbiome, which can lead to gut dysbiosis. Well, did you know that turmeric can act on the gut? Let me give you an example here. So they actually did a study on turmeric and the gut microbiome in rats. What they did was they fed one set of rats a lean and healthier diet, and another set of rats a high-fat diet. And when they gave the rats with a high-fat diet turmeric or curcumin, they were able to change the gut microbiome of the high-fat diet rats to the lean diet rat gut microbiome composition. That's pretty cool. I mean, you can change the bacteria in the gut just from turmeric. That's pretty crazy. And while we're on the topic of the gut microbiome and turmeric, what they actually found in another study, turmeric can actually help with a leaky gut. Now, as you all know, leaky gut is such a popular term these days. Everyone's saying, I have leaky gut. Leaky gut can be a manifestation of an imbalanced gut microbiome. And in the study, they did find that turmeric can potentially help with leaky gut. And I'm not surprised because it is a vegetable. And a lot of vegetables and spices have the power and ability to help with a leaky gut. And why is turmeric so powerful? I mean, it can work on the gut microbiome and it can also help with inflammation also. And let me give you an example here of why it can help with pain. So they did a study with turmeric and an NSAID or non-steroidal pain medication called diclofenac. And what did they find in the study? So they looked at rheumatoid arthritis patients with these two substances, turmeric versus diclofenac. And what they found was that the turmeric group actually did much better than the diclofenac group. That's pretty cool because most of us are probably taking ibuprofen, Advil, naproxen, and diclofenac. But none of us, when we think about pain medications, think about pain supplements, which include turmeric. So next time you have an arthritic attack, consider turmeric over ibuprofen because the side effect profile is a lot less. And also, curcumin was also studied for knee osteoarthritis as well. And for those of you that don't know, osteoarthritis is the wear and tear type of arthritis. And in the study, they took turmeric or curcumin 2 grams versus ibuprofen 800 milligrams for 6 weeks. And guess what they found? They found that the group that took turmeric for about 2 grams for 6 weeks did just as well as the group that took ibuprofen at 800 milligrams per day. I mean, next time I get pain, I'm going to continue taking turmeric because the science says that it's just as good. And when I get my arthritic attacks, I love taking turmeric. I always aim for at least 2 grams per day. Sometimes I'll even take more if needed. But when I talk to my patients, I say, try looking at 2 grams a day. And they will ask me, hey, Dr. Yu, what's the highest dose that I can take for turmeric? Well, I'll tell my patients that The highest dose that's ever been studied in literature is 12 grams per day. And if you think about the number of pills that you need to take on curcumin, 12 grams per day, it's a lot. Because if you go to your grocery store or another store, Amazon, you buy turmeric supplements, it's about 500 milligrams per pill. So in these patients that took 12 grams of turmeric, they were taking, let's see, 12 grams divided by 500 milligrams. So you're looking at maybe 20 pills or higher per day. And these patients that took 20 pills of turmeric or 12 grams worth, if it was 500 milligrams each, of course, the biggest side effects were orange stool, not surprising. It's orange pills. But some of them had liver toxicity. Other people had stomach aches. So not surprising if you're taking that much of a supplement. And you gotta be careful because you can have higher bleeding risk when you are on turmeric, especially at that high of a dose. I did talk about how turmeric can relieve pain, but did you know that with relieving inflammation, the way it can work is that it can lower this inflammatory molecule in the body called NF-kappa beta, and that molecule in the cell can kick off a whole inflammatory cascade in the body. And another way that turmeric can lower inflammation is that it can lower a type of immune cell called T helper 17 cells. And T helper 17 cells or Th17 cells are pro-inflammatory immune cells. So it can lower that too. That's amazing. Turmeric can do so much. And not only that, another thing that's really cool is that turmeric can also jack up a T cell or immunological cell in the body called Treg cells. And Tregs are very important because T regulatory cells help you fight viruses, bacteria. But not only that, T regulatory cells can also lower inflammation. So if you have an autoimmune condition, most likely your body has a very low T regulatory cell count because T regulatory cells help your immune system from attacking itself. And turmeric and curcumin can help increase those levels, and that's what we want. And for those of you that are taking medications called biologics for your autoimmune condition, especially in rheumatology, such as Humira, Enbrel, Simponi, Cimzia, or Remicade, what's common about these biological medications is that they block a family of molecules called turmeric necrosis factors. And what turmeric necrosis factors, or TNFs, are, they're pro-inflammatory immunological cells. And what's really interesting is that turmeric blocks that same pathway that these powerful drugs also block as well. Of course, it's not going to be the same strength since we're comparing a supplement to really strong medications, but it's really interesting that it also blocks that pathway as well. So that's why I say that turmeric does a lot of things and it's so powerful for pain and arthritis. Now, the drawback with turmeric is that it has really low absorption. It has very low bioavailability. That's why sometimes you have to take more of it just to get the same strength. And in studies, they found that when patients took turmeric, the amount of turmeric and curcumin in the blood was very little. However, there is a possible solution to increasing the absorption of turmeric, which I have talked about in this video, where I talk about the different generations and the new technology regarding turmeric supplements. Now, if you haven't watched the video, I'll give you a quick sneak peek to that. There are 3 new generations of turmeric. There's a first generation, second generation, and third generation. And this is based off of new studies that talk about how old and new turmeric supplements have been created and the differences between the different generations of turmeric. And the newer generations of curcumin supplements have potentially better absorption. But of course, it's a bit more expensive as well. So just because if you're taking a first generation doesn't mean it's worse than the third generation. It may work just as well. So if you haven't watched that video, I will highly encourage you to do so because it's new cutting edge scientific evidence on the different generations of turmeric supplements. And if you're looking to buy turmeric supplements at the grocery store or online, you gotta educate yourself and find out what the biggest differences between them are. So I want to hear from you. What do you think about turmeric supplements? Has it helped you at all? I know it's helped me. It's one of the first supplements I took as an autoimmune patient. And I really hope it can help you too. It certainly has helped my patients. But of course, we always gotta be careful with the side effects, which can include increased risk of bleeding. It can have liver toxicity, but of course, that's very uncommon and rare. But it's been reported in scientific literature. And don't forget, you can have orange stools. I have not heard of that from my patients, but in that one study, when they took 12 grams of curcumin, one patient did have orange stools. Well, it's so nice to talk to you once again. I hope you learned something from this video. I really enjoy making these videos to educate you all. Well, I'll see you guys next time, where we'll talk more about autoimmune diseases and integrative medicine.